I'm just waiting for you to. Okay. All right. Welcome to Good Gut Live, where we talk about all things related to gut health so that you can heal with each meal. I'm Dahlia Marin. I am an integrative registered dietitian, certified gastrointestinal nutritionist, and one of the co-founders of Married to Health. I'm always excited when we have exciting guests who are joining us, talking about the things that they are passionate about that are related to gut health and your good gut. So I'm really excited for the guest that we have here today, Dr. Andrew Sharobeem. I'm going to let you introduce yourself because I want people to hear directly from you all the cool things you have going on and what we'll get into talking about today in your specialty.
Thank you so much, Elliot. And I appreciate being here and having the opportunity to kind of, bring awareness to what we're going to be speaking about today. But just as a short little intro, my name is Andy Sharobeem. I am a licensed rheumatologist out in Arizona currently. I did work out in New Jersey and did some rotations and I had experience throughout several states in the country. And my my trajectory, I guess, was through medical school as an osteopath. I went through a doctor of osteopathic school medical program in New York, and then went through Rhode Island for my residency for internal medicine, and then trained in the University of Arizona in Tucson, Arizona for rheumatology itself. And then I just kind of flip flopped around between the East Coast and West Coast and landed back here in Arizona in the Valley. So that's a little snippet of, where I was and where I am today.
And what got you interested initially in rheumatology? Because it's quite the complicated specialty. What made you feel like this is where I need to be? And then you picked a subspecialty, which is even more involved. So I'd love to hear that journey.
So it really was a journey. It's pretty complicated, as I am myself. And what occurred was that I was like every other med student at my age, very young, still in my kind of formative years, if you will, in all aspects, all regards. And when I
Mhm.
was going through the motions, I was like everybody else. Let's try out this. Let's try out that. Just keep an open mind. Try to figure out what my niche is. And eventually, I was exposed to the field of rheumatology in my rotations, and that allowed me to kind of open my mind to specialties that not every other med student is talking about, because let's face it, everyone usually starts talking about cardiology, GI, hematology, but no one's really having a discussion or conversation about the importance of rheumatology. And uh,
Mhm.
if you don't know, there's not too many rheumatologists in the United States. So
Yeah.
when I was exposed to that, what I kept an open mind about was, what is my personality? How do I fit in the niche of the medical field and community? How can I be of service to my fellow man or a woman? And what I found was that rheumatology encompassed a lot of what I love about being a practitioner, diagnostician, just someone that can
Mm.
help people. That included seeing people from all walks of life. That included seeing all types of age ranges, from 5 to 99. Also, focusing on quality of life. I started believing that my niche was to focus on people's not just longevity, but how to reduce and how to prevent handicap, how to reduce
Mm.
and how to prevent things that can put a wrench in the gears, so to speak, so that you could live long but healthy and happily, right? So when I was looking into this, rheumatology started fitting the bill slowly but surely. And on top of that, we are the mystery docs, right? I realized that people send to rheumatology when they have no idea what's going on. So
Uh-huh.
then we're sitting here, we also have no idea what's going on, to tell you the truth, but we end up, breaking it down and trying to find out every possibility. So we're dealing with every organ system, every aspect of that human's life, and trying to figure things out. We're detectives of the medical world. So in short, that's what kind of helped me out. And of course, one of my close cousins, who's like a brother to me, he's also a rheumatologist. I work with him now in Arizona, and he was a
Nice.
very big he's a role model for me, and he was a very big influence in that regard.
Mhm. I love that. It's such a beautiful journey, and I think so needed because I think there I don't know if I've heard incorrectly, but I think there's a big stigma around rheumatology and just personality types, bedside manner, and them kind of, yes, being very knowledgeable, but not always most compassionate because I
I get it.
think it's such a complicated field. So I think, people end up seeing a lot of Dr. House type of personalities, but I
Right.
I love that you're coming in, you're changing the game. You're really seeking to bring just compassion to the field as well with those who, like you said, are suffering usually the most, who have the most complicated conditions going on and who really do need the most compassion and the deepest level of care. And you've kind of taken interest in a subspecialty, a certain population that you often post about with those who have dysautonomia. I'd love for you to explain to people what dysautonomia is, what other conditions or disorders fall under that, and how you became interested in this really important class and subspecialty of people who really do need that investigative lens and that compassionate care.
And I appreciate you kind of segueing into that, and appreciate the sentiment. That's very kind words. But I can tell you right now that dysautonomia is not something that somebody gives you a certification for. You don't go through schooling for this. This is
Mhm.
something that over time, right? Something that over time that you dub yourself. Hey, I'm just gonna be passionate about this, and I guess I'm a specialist. But it's just an affinity you have for these people that are suffering, and nobody knows what to do with them. So you kind of
Yeah.
say, you know what, let me try to help these people if I can. So with this autonomia, the reason why I got into that myself and have such a passion for it and awareness for is because of my zebras, my EDS population. Ehlers-Danlos patients, they know as well as I do, as well as you do. This autonomia runs amok in that catchment of patients in that demographic. So I had no choice but to have an affinity towards this autonomia. So I said, you know
Mhm.
what? It's here to stay. I got to look into this. I have to be more knowledgeable about this so I can better serve this population. So when it comes to dysautonomia, it's more of an umbrella term in the medical field. It's not specific. There are
Mhm.
origin stories, and it's not one size fits all. But when we say dysautonomia, it's basically what I like to say is your nervous system on fire, right?
Mm.
Just like with anti-NMDA encephalitis, autoimmune brain disease, how your brain is on fire.
Mm.
This is your nervous system on fire. But it technically has nothing to do with autoimmune origins to date, as far as science is concerned. It is more so due to a genetic predisposition. And unfortunately, it literally wreaks havoc on the nervous system that we take for granted every day. That is our autonomic nervous system. Parasympathetics, sympathetics, everything that helps swat away like flies, all the onslaught of everything that can make us crumble every day, we are in equilibrium and homeostasis because of this autonomic nervous system. We're able to
Mm.
live every day, wake up, sleep, do our thing, push through, all because our autonomics are stable. The problem arises when dysautonomia occurs from a slew of disorders that then doesn't allow us to live technically, which then
Mm.
makes this a quite debilitating disorder.
Very. And when people come to you, what are some of those red flags that you kind of see, or some of those clues that you feel like you want to investigate more deeply and try to diagnose them with, whether that's POTS or Ehlers-Danlos syndrome or one of those other conditions that falls under that umbrella of dysautonomia?
I've gotten to have quite a knack for detecting Ehlers-Danlos.
Mhm.
Just talking to you for 5 seconds,
Yes.
it's something in the face, it's something in the mannerisms, it's
Mm.
something in how you discuss things, what your affinity is towards what's the discussion going to be like with that patient. So
Interesting.
when they start looking into, for instance, somebody comes to me, right? And in the office, they have an ANA positive. That's pretty
Mhm.
much the biggest proportion of consults that we get. ANA positives, it could be any symptom, but it's an ANA positive. When they come to me, 99% of them do not have lupus, you know? And like you
Mhm.
said, like Dr. House, I mean, it's not lupus, right? So it's usually never lupus, right? So the problem with that is that when you have somebody coming in, they're trying to look for answers and they're
Mhm.
latching onto anything. But what happens in that conversation means the world. That's why it's so important to have a good history. I'm a big fan of timeline.
Mhm.
Timeline will make or break diagnoses. I mean 1 in a million diagnoses to the 1 in 100 diagnoses.
Yeah.
It'll make or break it. What does that mean? If you have someone complaining of lupus like features since they were 5 years old, never treated, and now they're 35, chances are you don't have lupus. because
Mhm.
lupus, in essence, in the first 5 to 10 years of disease, will do something to you.
Mm.
It'll wreak havoc on your system if it's not treated adequately, unless you have the most mild form of lupus on earth that known to man and known to science.
Yeah.
These are the little bits of history that I take from the patient and say, listen, I don't know you from a hole in the wall, but if you've had all these symptoms of lupus since you were a kid and you were never treated, most likely it's not lupus. So these are the little
Mhm.
things you pick apart. On top of that, all of the constitutional stuff, like the patients that come in and say, I have low grade fevers for no reason.
Mm.
Nobody knows why. Since I was
Mhm.
10 years old, I have brain fog. I'm always tired. Why? I'm 20 years old. I should have all the energy in the world. My genetics should allow for me to keep going, regardless if I get 3 hours of sleep or 10 hours of sleep. I should keep going because that I'm not deteriorating yet, you know, in the basis of
Mhm.
science. All these little things. And of course, I've had gut issues since I was a kid, all these allergies. I have all these issues with going to the bathroom, like my bladder wants to go, but it doesn't want to.
Mm.
So you start paying attention to the neurogenic issues, the things that are imbalanced, the things that the autonomic nervous system controls, but now is not controlled as an individual. Those are the keys to the history that brings me towards and closer to dysautonomia, and then trying to figure out the primary causes, which we can get into if you'd like to.
Yeah, I'd love to hear more about it because I think there are so many people out there searching for answers. And I think just the more information that people have, the more that they can say, "Ooh, this is something I think maybe sounds like me. I'd like to pursue," or, "Oh, you know what? I don't think that is. And I'm going to continue to search for my different answers." So I'd love to hear more about what people can kind of write down on their notes of whether they should look into seeing a rheumatologist or if they should continue searching for other answers based on those symptoms you described in others.
That's perfect. I mean, of course, shedding that awareness is paramount. And what I can say is that if you've lived your entire life, this is the simplest thing I can say to anybody listening in. Um, the simplest thing I could tell you is if your entire life has been a diagnostic journey,
Mm,
and it has been debilitating, and you have doctors, ping ponging you left and right, and you have all these weird symptoms nobody knows how to attach to a textbook definition of a disease, look into this stuff. Look
mm,
into dysautonomia and its causes, because it is way more common than we have originally thought and even think today,
mm.
right? It is so common that I feel I diagnose that more to this its primary causes than I diagnose rheumatoid, lupus, scleroderma,
Wow.
Sjogren's, all in one
Mm,
basket. Now, I can tell you that aside from the Ehlers-Danlos population, the other most common causes of dysautonomia is actually one specific autoimmune disease, which, of course, ironically, we don't have FDA approved treatment for,
mm,
Sjogren's. Sjogren's
mm,
disease can easily cause your small fiber neuropathies, your dysautonomic effect, the autonomic issues, um, along with antiphospholipid syndrome. This is an interesting
mm,
one, seronegative or seropositive. But if somebody has the antiphospholipid syndrome, meaning, excuse me, the antibodies towards it and not the manifestations, for instance, blood clots, strokes, miscarriages. You can also have a diagnosis of fibromyalgia at the tail end, or chronic pain, or central sensitization, or ME/CFS, because for some reason there is a link between having those antibodies roll around in your serum
mm.
and dysautonomia. And the guru of
Interesting.
antiphospholipid syndrome actually coined this in one case report, or a cohort of his own.
Mm,
So it is actually something that I've been seeing in clinical practice since I've opened my eyes to it. But other than those, PTSD, complex PTSD, psychosocial stressors, trauma. If anybody's ever heard of ACE scores, adverse childhood exposures, events, experiences, however you want to term that 10-question survey where you answer yes to four or more, and it's childhood abuse, it's incarceration, it's alcoholism, it's all this nasty stuff that shouldn't happen to a child in their formative years, what have you. All these can actually increase your risk and predispose you later on in life to decreased longevity,
mm,
increased comorbid conditions, cardiovascular implications, autoimmune disease, and dysautonomia, and
mm.
mental health disruptions on top of that to boot. So those are the big ones for me, and I always make it a point to break that down for my patients when I see them and they have these features.
Mm, so interesting. And I know that in the dysautonomia community, there is talk with mold. What do you tend to see? And is there any validity to that? Are there any studies that have correlated the two? What do you tend to see with mycotoxin illness or mold toxicity? Is that something that you tend to speak to your patients about or they report to you?
So I tend to kind of break the ice, if you will, scratch the surface of it, because I can't say I'm a specialist in that regard. I
Hmm.
can't say that there's robust, there's not a lot of data in a sense of funding. There's not a lot of
Yeah.
funding for EDS. There's not a lot of funding for mold toxicity and what it can do to the human body and the microbiota. Um,
Hmm.
so my problem is that I can only speak from experience, but I also lean on my favorites in the field of naturopathy in my vicinity, in my circles. I lean on them to help me out with that kind of thing, because at the end of the day, I can be aware of it, but I don't know how to delve deep. I don't know how to intervene. I just know that if my patient is telling me, and I have some patients like this, a lot of them have EDS. So
Hmm.
I can tell them that, and they tell me, actually, they say it's that, prototypical, they go on vacation and they feel better. And I ask, why do you feel better on vacation for a week or two? Because I'm out of my house. What does your
Hmm.
house have that your vacation doesn't have? Hopefully, if you're like in a stateroom, or like a what is it called, a hotel room that is not infested, it would be something like mold, something in the walls.
Yeah.
Someone didn't take care of that dwelling before you got in there and moved in there. So
Mm.
yes, I do believe that there is a possibility that mold toxicity can then trigger. Obviously, we can talk about the microbiome all day here, but it can trigger something through that kind of leaky gut bacterial overgrowth and toxicity. It can trigger autoimmune entities. It can trigger chronic fatigue syndrome. It can trigger dysautonomia. And a lot of people, they'll do heavy metal detox and mold, detox and things like that. However, it's about removing that source of your ailments first, and then figuring out through naturopathy or conventional medicine what we can do for you furthermore. But yes, I do believe in that. I do believe there's an issue there. I have a lot of patients who literally all they have to do is move out of their dwelling. However, financially, they're restricted.
Yeah.
They just don't have the funds, they don't have the means to move. And that
Mhm.
is the biggest issue that I run into when it comes to that.
Same,
Yeah.
absolutely. But I love that, you're open to it. You're acknowledging all these various ways that somebody might come upon this diagnosis. Somebody might be eventually diagnosed with this. And, it's so important to really incorporate that mind, that physical, that emotional, because our nervous system will really absorb it all. And we
Right.
do know there's that direct gut brain connection. And I'm a GI specialist. I'm somebody who's always keen to kind of hearing these gut symptoms from people. On your end, and from what the data shows as well, what are some of the GI symptoms that your patients are reporting to you? And in your experience, why do you feel like they are experiencing some of those GI symptoms? And then they're sent over to somebody like a gastroenterologist or even a gastrointestinal dietitian as well to join the team to really help them out. Because one thing that I hear a lot from my patients, especially when they're younger and they're brought in by their parents, is they're almost misdiagnosed or mislabeled with an eating disorder because they might have a very small appetite. They might vomit frequently. They might be a very selective eater. And oftentimes they are mislabeled even by their own parents as somebody with disordered eating or an eating disorder. But once we dive deeper, we really find out, oh no, you have really complex GI involvement as well. So what are some of the GI symptoms that you tend to see in your patients and things that clue you into, okay, this person needs a little bit more GI support?
Oh no, I love that you brought that up, because I can talk about this for hours. I'm sure you can for days and weeks. But um, what I can say is that I've seen everything from as simple as IBS, as we know it's a symptom, IBS,
Mhm.
all the way through to gastroparesis. I mean, and this is not a diabetic complication for my
Yeah.
catchment of patients. This is an issue with the autonomics and the microbiome and dysbiosis. So I've seen it all. I've heard it all. The issue is that you're lucky if you can get an integrative GI specialist that is not a naturopath or a functional medicine doctor or dietitian. And unfortunately, the problem is the limitation here for helping these people out is the fact that a lot of people, they can't work under insurance, and I understand why. But unfortunately, they have to spend money, and a lot of these patients, they just go through conventional GI docs, which they do their work, they do their thing,
Yeah.
but there's a limit to them. And unfortunately, I'm like, okay, then you have to go spend this much money to go see this person because I know they'll help you.
Yeah.
because at the end of the day, it's your health. You need to keep thriving, and you can't if you have this issue. So that's a pitfall. But without delving deep into that, the IBS into the intro into the gastroparesis and that continuum, what I feel is, of course, as you know, the human genome has nothing on the gut brain genome, right? The microbiome, it's 10 to 1. The microbiome has so much more, so many more genes than the human
Hmm.
genome, combined, right? And we know that there's 100 trillion, you know, as far as bacteria are concerned,
Yes.
inhabiting at least the large intestine, right? And all of this is affecting our mood all the way to our immune system, to our wound healing, to everything that we have to function off of, right? The things we take for granted. On top of that, we have these issues with, it's a vicious cycle from for our formative years and our and my EDS population. There's a lot of trauma. There's a lot of PTSD. There's a lot of ADHD. There's a lot of all these like labels being thrown out only because it's something that has a direct and indirect link to these patients growing up. For whatever reason, there's an attachment from how you are born with the central sensitization, the autonomic nervous system, the nervous system being on fire, along with that trajectory of trauma, psychosocial stressors that has this vicious cycle of gut permeability. But why does that happen? We're increasing neurotransmitters with inflammatory cytokines.
Mm.
That in turn, right, it hits the HPA axis, and then ACTH, and then adrenals, and then cortisol. And you know that chronic cortisol elevation is not going to bode well. What does that do? It
Mhm.
causes dysbiosis. It causes leaky gut, right, as what we term it. And what does that mean? Leaky gut then causes permeability to occur. Then we have all that bad stuff, we'll just quote it as bad stuff, going through and wreaking havoc in the system,
Yeah.
causing inflammation, immune system issues, and then, of course, the dysautonomia can occur from that too.
Mhm.
So that is a vicious cycle that we're trying to break here. But what came first, chicken or the egg? Is, let's say, a genetic disorder like Ehlers-Danlos predisposing these patients to sensitization, leaky gut? Is it the PTSD from the trauma? Is it something else than that? Is it some other genetic variability that we don't know about yet? But we can
Mhm.
talk again, like I said, for hours about this. However, root cause analysis is extremely important. And I love what you guys do. It's amazing. It's essential and salient. And a lot of people don't realize that yet because there's not enough data.
Yeah.
You guys are on the forefront. You're going to have that data in like 100 years, but still, you're helping people out, right? Even an ode to
Mhm.
my friend who I went to school with. She's amazing, Elena Ivanina.
She's
She's in New
awesome.
York. She's awesome, right? I know you guys know
Uh-huh.
her.
Yeah.
She's quadruple board certified. She's integrative. She's a gut specialist. She talks about this all the time.
Mhm.
And unfortunately, some people will think this is like pseudoscience, but it really
Mhm.
isn't. It's just science that hasn't really been, the masses have not adopted it yet and haven't really
Yes.
been convinced. And that's unfortunate, but sooner or later, we're going to have people jump on the bandwagon.
I hope so, because we do know, right? The data shows it takes 12 to 15 years for something to make its way into the guidelines. And I think a lot of practitioners just out of an abundance of caution wait till something is part of the
Yeah,
guidelines to speak to it. But I so admire both you and Dr. Ivanina for what you do of
thank
just
you, Jen.
wanting to help people really. And whether you're saying, hey, this isn't part of the guidelines, but I really feel like we can use pieces of data to really put this together for you, create this health story for you, and really help you feel better and really get some answers. We're checking off all these different boxes, things are coming together for you. And I just feel like it's so important. I feel like practitioners like that are really few and far in between, very diamonds in the rough, because I think so many people come from a place, unfortunately, I think with our US medical system of
Yes.
just caution and fear, rather than remembering that role of care that you really set out on this journey to step into. So I think it's so admirable that practitioners like you are doing that and are willing to hear these people's stories, willing to listen to them, acknowledge what they're saying, and help them find more clues along their journey. Because, like you said, you're likely not the first person they've seen
Yeah.
or even the 10th person that they've seen. So people often have been living with this for quite some time, and they're tired. They're
Yeah.
dealing with these things day in and day out. So it's nice to just have that person who's willing to listen, who's willing to really acknowledge what you're saying and really just make you feel like, okay, I'm heard. I have somebody who has more information than I have, because when you have a complicated condition, a lot of times you have really become an expert on yourself. So it's nice to be able to bring all those pieces to somebody else and say, hey, this is what I have. What can you do with all this? What can you do with all these pieces? What's the puzzle and the picture that you're seeing with it? So definitely when it comes to that GI involvement, there's so much crossover. So it's so great that we can collaborate on things like that and really get people feeling better, whether we are trying to assess, do you have small intestinal bacterial overgrowth or microbial dysbiosis, because maybe you have hypermobile Ehlers-Danlos and maybe you have just lax sphincters, those little doors that separate the
Hmm.
different compartments of your GI tract, and that's enabled some of those colon microbes. We have over, like you were saying, 100 trillion microbes living in our entire GI tract, but a large majority of them in the colon. Maybe they've migrated up into the small intestine because your nervous system isn't really able at that moment to control when to close and when to open up. Maybe you are somebody who is having significant histamine intolerance. And so you are constantly having a small appetite, vomiting, you're having nausea, constipation, diarrhea, what have you, with the rest of the symptoms that can come along with it. So it's so important to be able to recognize the signs. And I'm sure that you see day in and day out, people just have a sigh of relief. They give a sigh of relief when they say, oh, okay, you get it. You get why I'm having this symptom. I know for me, a lot of times people are like, oh, okay, I'm so glad that you
Hmm.
understand why I'm having gas that smells like rotten eggs. And, it's not
Yep.
something that I have to be embarrassed of or think is very odd, because for you, you're understanding and you're able to tell me why I'm experiencing that symptom, not just say, oh, that's interesting and kind of move on from it. So I love that. I love that, there's so much of that collaboration that can happen. There's so much of that peace that people just walk away with after being able to have support in that arena.
I agree with you, and I appreciate the sentiment. And again, I appreciate what you do too. It's just, like I said, it's on the forefront, and it's a very, it's you're like, you guys are pioneers. I mean, this is just what it is, and you are helping people, and you see it day in and day out. And these people are coming back and very grateful to you, I'm sure.
Yeah,
And this is what
likewise.
it's about, being on the the forefront. Because if you're just kind of lying back, waiting for something to occur, you're going to leave all these people in debilitating pain and
Yeah,
issues where you could have been of service, and it doesn't take too much. It doesn't take too much out of you to kind of expand. Our minds are able to absorb a little bit more than what our textbooks allow for. So, it just, I always tell, people, just keep an open mind. Med students that rotate with me, just keep an
mhm,
open mind to the human condition. I mean, not everything is clear cut. Not everything is just based off the textbook. Open your mind, think outside the box, try to help these people out, get that timeline in, figure out what happened. Why are they like this? You have to be a detective.
yes,
Otherwise, you are falling short of your potential of helping this human right in front of you. And I love that you brought up histamines. That is a big one.
yeah,
um, I know there's a question about, is there a one size fits all diet or modification? Of course, like, saying
mhm,
diet is kind of faux pas at this point. It's more like we just need to modify. We need to modify our lifestyle here,
yeah,
based off what our body is telling us. And believe it or not, it's not all about gluten free and dairy free,
yeah,
although that messes with people. I would say that even histamine free or low histamine can, although not as sustainable, because a lot of people hate me when I tell them to what the histamine rich foods are out there. Most people
uh-huh,
are eating that in a balanced diet, but
yeah,
I can tell you right now, histamine is a very big issue in the catchment of patients that I see,
mm,
especially Ehlers-Danlos. There are people I see at 75 years old, at 25 years old. I tell them, hey, just remove a little bit. Let's do a little elimination thing. Get rid of the avocados, get rid of the bananas. Even though, like, the pre and probiotics and all that stuff, let's just see what happens. You tried all this other stuff, humor it. See what happens. And some people just come back with a um, a banana and avocado free diet, let's say diet, and in a month their fatigue and brain fog is cleared, and they no
mhm,
longer have constipation. It's amazing. It's amazing. So histamine is a big one, because not only do they affect the microbiome when they degranulate in high stress issues, as you know, they
mhm,
also cause issues with mood,
mm,
and it causes
yes,
issue with pain.
mhm,
Degranulating histamines actually increase risk of neurotransmitters that then have that, that nociplastic, nocicyst, like an nociceptive issue where you have that firing of that nervous system and
Mm.
nerve signaling that causes pain. Histamines are a big part of that in the EDS
Yeah.
population. So
Mm.
it's very important to talk about histamine too.
Absolutely. And so, I always give that analogy. Everyone has a different size histamine bucket, a different size bucket of tolerance for histamine. And if already just having dysautonomia is kind of filling up your histamine bucket, you're in pain constantly, your immune system is already activated. Maybe you are constantly feeling that high anxiety, high adrenaline, and that's filling up your bucket. Adding foods is just causing it to spill over. And that's when those symptoms worsen at that moment. So, yes, absolutely try to make it as tolerable as possible. And then I love to help people identify tools as well, because like you said, it's not fun to cut out avocados, bananas, chocolate, fermented foods. These are foods that are touted as really good for your gut. And I think it can be confusing to that population because then they're told, oh, actually, that's not good for your gut. It's good for the gut in general, but for your gut, that's not something that's going to be helpful. So there are so many amazing tools and resources out there that I like to use to help people maybe tolerate some more histamine, just different tools that I'll explain. Either put basically a spigot on their bucket, some enzymes like DAO. They can take the DAO enzyme to help break down the histamine. They can also use histamine receptor blockers or histamine receptor agonists to kind of cover up part of the bucket. They can use things like mast cell stabilizers, since we know those mast cells are very much involved in producing histamine. So I love being able to give people those resources, or ask them to ask their care team about those resources, because then they can have some histamine, then they can have some relief and respite from some of those symptoms and get the benefits of both worlds. So I love that you're also educating your population. And I know that each of us can dive really deep in our respective specialties. Who do you feel is a really important member of a dysautonomia care team? Who are some of the top specialists or top healthcare practitioners that you're really referring your patients to and saying, you need this type of specialist on your team?
So it all boils down to, again, the context of which we're discussing this, because anybody can technically be a dysautonomia specialist, because the root cause is what is going to be dictating who we send to. Correct.
Mm.
So if my feeling, my gut feeling, literally and figuratively, is the your mast cells or your histamine is going to be the majority, the elephant in the room, if you will, then I need to find not only an allergy immunologist, I need to find an allergist immunologist that has an awareness of this histamine
Mhm.
mast cell combo in the Ehlers-Danlos population, for instance. And good luck trying to find somebody like that. And
Yeah.
then good luck trying to find somebody that's covered by insurance. And good luck finding somebody that'll take mast cells seriously,
Mm.
even if they are. So these are the pitfalls. The pitfalls are not, it's the affinity towards this stuff because, science is still catching up with it. Also, the fact that even if they find out that they have this issue, because as we know, mast cell, testing for mast cell is obsolete. I mean, it, it's such a waste of time that
Mhm.
you almost have to go with your hunch and your gut feeling as opposed to what the testing shows. That's one
Mhm.
thing I tell my patients all the time. But in order to get the doctor on the bandwagon, they need to see something. They need to see something in front of them.
Yeah.
Unfortunately, half the time you don't. So directing care for dysautonomia purposes would be first get the root cause, figure out if a histamine mast cell thing needs to be addressed first, if a POTS issue has to be addressed first. There are so many POTS, POTS falls under the umbrella of dysautonomia.
Mm.
And for a long time, POTS was synonymous with dysautonomia, surprisingly enough. But POTS, even, there's a malabsorption issue. There's a
Mhm.
dehydration issue. They could be chugging 4 liters of water a day with electrolytes. It's not going anywhere. They're
Mhm.
like almost third spacing at this point. The
Mm.
problem is that when you understand histamine, when you understand POTS, when you understand central sensitization and dysbiosis, you have to think outside the box. You can no longer be in this box anymore. There is no box, right? It's like the Matrix.
Yeah.
So you have to be able to then figure out what is this root cause, who is a specialist, who has the awareness in that specialty, and then send them towards that doctor, that diagnostician,
Mm.
that healthcare practitioner, that allied health professional that can
Yeah.
help them. And of course, as we know, it's not always just in the medical, like the strict allopathic world. It's naturopathy, it's functional medicine, it's dietitians, it's occupational therapists, it's sports
Mhm.
medicine, it's all these beautiful, amazing human beings that are aware and they know what they can do on their end to help this person out, basically.
I love that. So somebody who has, like you described, an open mind and in my opinion, an open heart as well, who's willing
Hmm.
to just listen, support, and really bring in tools that are helpful to this population. So it could be somebody who's physical and hands-on, like you said, occupational therapy, physical therapy. It could be somebody who's working on lifestyle, like a dietitian. It could be definitely a specialist like an allergist, immunologist, gastroenterologist, a cardiologist, rheumatologist. So really finding those diamonds in the rough. And it's nice when we band together because then we can kind of point people to each other
Hmm.
and say, hey, I think you should see this person. I think you should see that person. So
Right.
it's a beautiful thing when people receive that support. And hopefully we will see in these next coming years more and more of that support, not just again, evidence based support, but really just compassion based support as well, because it's so important in this population as well. They've already been through so much in their own bodies. And I think adding medical trauma on top of that is just an unnecessary layer that so many go
Yeah.
through.
Agreed. And I always tell my, colleagues, peers, and even med students going through, I tell them, listen, what if this was you? What if it was a family member? I
Hmm.
mean, wouldn't you want people to take you seriously? I mean, what is the percentage of the population that are actual malingerers and psychopaths, like in the strictest of sense, in the
Yeah.
scientific sense, right? Pathophysiologically. I mean, there's not too many malingerers out there, that people that just want to be sick and want to go see doctors for no reason whatsoever. No,
Yeah.
most of the majority of people, they don't want to be sick, they don't want to see you, they don't want to see doctors, they don't want to take medicine, but they're going in because they're like, there's something wrong with me, nobody wants to give me answers, help
Mhm.
me. And sometimes they become a little desperate to the point where they get irate and livid and all that stuff. There's a line, there's a respect line, right? You kind of have to respect your fellow person. And then of course, there are people that get a little, just kind of, they go off the beaten path, and like there's no helping them. But I always tell people, that I understand that this has been a journey for you, and a horrible one. And I'm going to
Mhm.
try my best to try to, mitigate that and facilitate for a direction of care that means something to you as an
Mhm.
individual. But
Mhm.
sometimes we don't have all the answers, even in modern medicine or outside of modern medicine. And unfortunately, some people draw the short, and that's just kind of life sometimes. And unfortunately, I
Yeah.
have to say the truth. I have to tell them the truth, because I don't want to beat around the bush. I don't want to sugarcoat anything.
Mhm.
But majority of people, they're looking for answers. They've just been shot down and passed around. And again, like I said, what if this was you? What if this was a family member?
Mm.
Treat them the same way. That's it. That's all you got to do.
So important.
Yeah.
And we have a community in our space. We have our Good Gut members. So we have our Good Gut community that we have. We call them our Good Gut gang. And we received some questions. So I'd love to ask you a couple of these questions that our Good Gut gang members were wondering before I let you go today, because I think these are important questions to be asked. And someone's asking, I'd love to ask his thoughts on whether hypermobile folks generally have different nutritional guidelines than non hypermobile folks. For example, I know Dr. Aaron Hartman thinks veganism is the worst possible diet for hypermobile folks, but I discussed that with a hypermobility savvy PT who said that isn't true at all. And I know you touched on this very briefly, but do you tend to see any variance there between EDS, whether they have hypermobility or a lack of hypermobility with as nutrition and what they need in respects to nutrition? I know I can speak to this a little bit as well.
Of course you can. I mean, I would definitely, this is where I would actually send somebody to you and have them have a deep discussion, because you'll spend time, you'll actually break it down for them. But just to, again, surface level, I can tell you right now that it's not one size fits all, as we already discussed. It's not just as simple as saying, go on a Mediterranean diet, go vegan, go raw vegan. It's very
Yeah.
different for everyone, and you have to listen to your body first and foremost. And of course, the testing that our you guys do, and our naturopaths here in the valley do. I mean, we all doing things like, simple as indican levels, to all the way up to doing really you know extensive small intestinal bacterial overgrowth testing, and figuring out which type. I think there's like 3 types right now. I could be
Hmm.
wrong. And so we look through all of this, and we need the help of our allied health professionals, and like I said, our dietitians, our naturopaths, our functional medicine docs. And we need help from a community of doctors and a network of doctors and practitioners and diagnosticians to really hone in on exactly what is that size that fits you. and your microbiome, because
Mhm.
there's no flat out standard of care when it comes to this. So truly, there's no answer to this until you've done the work with your practitioners to figure out what works for you. So yeah, I can't say that one diet is going to rule over another one. You have to truly do the work and the detective work in that regard. And of course, with the Ehlers-Danlos thing, there's 13 or 14 different types of Ehlers-Danlos. Most of them are from 1 in 20,000 to 1 in 1 million.
Mhm.
But the most common type is the hypermobile type. Ironically enough, we don't have a genetic mutation found yet, but our lovely genius scientists friends are doing a lot of work to get that done in the next year and a half. So it'll be
Nice.
amazing. But what I can tell you about that is that even our hypermobile type doesn't have to be hypermobile. There's a fraction of these patients that are born with central sensitization so bad
Mm.
that their muscle tension overwhelms the ligamentous laxity. So I can diagnose hypermobile EDS without you ever being hypermobile,
Hmm.
just from other features that really connect the dots for me with EDS. And that's why
Interesting.
these references, these criteria are only references actually, because you have to think outside the box with this too. So a lot of misdiagnosis. Some people think I'm overdiagnosing it. I disagree,
Mm.
but this is my little niche. I'm comfortable in it. I'm just comfortable in diagnosing it even without the hypermobility. So understand that you can still have type 3 hypermobile type
Mm.
EDS without actually having hypermobility, because the muscles are so tense and the nervous system is so shot
Mm.
that your ligaments don't have a chance to show how bendy or flexible they are, or
Mm.
how unstable they are, if you will.
Mhm. And that's so, so, so important, yeah, to understand, and having a great physician on board, and whether that's a great knowledgeable physical therapist as well, they can help put those pieces together. And as far as the diet piece goes, yeah, it is really understanding what other GI involvement do you have, because if you have SIBO, that will very much change the foods that you're able to tolerate. So you want to be able to kind of clear the weeds. I always say before you can get to the root, sometimes you need to clear out a lot of weeds and branches. And if SIBO is one of those, if you have other types of dysbiosis, dysmotility, if you do have leaky gut issues and gut barrier issues, you do want to address those, because sometimes those symptoms make it seem like it's something else and can kind of dictate what you need in your diet temporarily. For example, yeah, if somebody does have hydrogen sulfide SIBO, and maybe you're not tolerating a lot of sulfur at that moment, that doesn't mean that that's a long term way of eating for you. Maybe as we're addressing the hydrogen sulfide SIBO, we eventually have you temporarily on a low sulfur diet. And then maybe as we dig deeper, we're really understanding, okay, maybe for you it's low FODMAP that's helpful, because when you're bloating excessively, then that is also irritating your nerves and your muscles and your autonomic nervous system. Maybe it is a low histamine diet. So there can be different iterations for one single person.
Right.
And whether plant based or not, I think it's really just understanding those basic things to really understand, okay, if I am vegan, if I am plant based, what types of foods are best for me? Is it,
Correct.
again, yeah, that low histamine? Is it the low FODMAP? Is it the low sulfur? There could be others in that as well. Am I tolerating oxalates? So, really, just having somebody who's knowledgeable and understanding how you're reacting to certain foods to be able to pinpoint, it sounds like you might need this. Sounds like, yes, if you've been diagnosed with POTS, maybe you do need a larger intake of sodium. Maybe you do need that help with absorption. Maybe we need to work on your barrier. And then we dig deeper and we find some other tools and resources as well.
I totally agree. I mean, this is my POTS population too. The hardest part about it is, sometimes I have to get them on IV fluids week in
Mm,
and week out until they figure out their gut issues. And unfortunately, there's not enough gut specialists that can help out, in certain communities, to the point where we can then lean on getting things orally. Our nutrition and our hydration orally. And a
yeah.
lot of these patients are unfortunately just stuck on getting IV fluids, and some of them need ports because they need so much fluid directly into the vein that
Mm,
their veins blow because they have
mm,
EDS, right? So then the port is
mm,
placed, and then you have all those complications too. So it's hard to have that balance, because again, that awareness, that affinity towards these little nuances of the human body and the pathophys of what we're talking about today is is so nuanced that a lot of practitioners shy away from it. They run away from it. They don't
mm.
want to deal with it, quote unquote. So,
Yeah,
it's a work in progress.
absolutely. Another question that we have, again, a little bit overlap here, but wondering if I need to pay attention to any nutrients in particular. I have hip pain, mold toxicity, both exacerbated by my mild hypermobility. Are there any specific macro or micronutrients that you're really making sure that your patients are paying special attention to when you're seeing them with maybe instances like this, mild hypermobility and different types of pain?
I mean, regardless of what the genetic disorder is that has that root cause of allowing and predisposing you to it, like the hypermobile EDS, Sjogren's, PTSD,
Mm,
all the like trauma, anything that can elicit this kind of dysautonomia and dysbiosis. Um, like we talked about before, I hate to be, repetitive or redundant, but this is where I'd send you to Married to Health, and then and then have you guys, as the gurus of all this, kind of do your detective work and figure that out, because again, mold toxicity is no man's land for a lot of doctors and a lot of
yeah.
practitioners. You need people thinking outside the box for that specifically. The hip pain, pain in general, nerve pain, you have to understand your body so well, because I, not to scare the population, but I recently had a patient who told me, I had this bursitis for years,
Mhm.
and nobody believed me that it wasn't just fibromyalgia bursitis, for instance, or overuse bursitis. Someone finally just ordered an X-ray. That simple, just ordered an X-ray of that little area and found that they had a tumor in there. So
Mm,
this is what I mean by keeping an open mind, believing the patient, believing the person. And unfortunately, it's hard to come by those practitioners and diagnosticians, but when you do, you latch onto them because they'll do the work for you. They have that compassion, they have that affinity towards it. So like Married to Health does, you go to them, you guys, and then you break it apart, you do the detective work, you figure out if there's a link. And if there isn't, then there are other practitioners out there that maybe you guys can network with,
yeah.
that can also get down to the nitty gritty. And sometimes it's as easy as first doing the conventional approach, the conservative
Mhm.
one, but do it. Make your practitioner do it. Don't take no for an answer.
Yes.
If that practitioner is looking at you like you have 10 heads, move on. No more second
Mhm.
chances. You know what I mean?
Yes.
No, you're not crazy. You're feeling things, your body's telling you something. If somebody wants to look at you like you're crazy, then move on. Move
Mhm.
on from them. Don't even worry about defending yourself at that point. Move on to someone who cares, like you
Eh,
said, Dahlia.
yes.
Open heart, not just an open mind.
Oh, amen. I just think that's so important. I
Yeah.
always constantly remind my patients, we work for you. You do not work for us. You don't need to
Yeah.
show up here for us. We are here completely to serve you. And if we're not serving you well, like you said, move on, find another opinion,
Hmm.
get another perspective, get someone who will help you and not just leave you feeling worse than you already came in feeling. So important.
Right.
I can imagine that, your patients are constantly walking away with that validation, with just more information than they ever thought that they would receive. I know that this can be a heavy topic and a population who really goes through a lot. I'd love to end our talk with you sharing maybe one or two of your favorite success stories or your favorite patients who really did improve their quality of life with your help and help of other members on their care team, just to give people hope out there, because we're all about heal with each meal, feel with each meal.
Yeah.
I know you're very passionate about helping your patients just find that better quality of life and healing. So we'd love to hear some of your favorite patients, your favorite success stories, to give people that kind of northern light to keep focusing on.
Yeah, no, I definitely I love to admit that there are multiple success stories, only because you don't have to be a genius, you don't have to be a rocket scientist, or even if rocket science is that hard anymore. I guess it's easy now. I don't know. People are just, but either way, I'm digressing. What I can tell you is that my success stories come from the fact that it's not me doing the work. I'm just
Mhm.
opening people's eyes and bringing awareness. It's the patient doing the work.
Mm,
Once I see that the patient does the work, I tell them ultimately, if you advocate for yourself, if you push through and you're doing the work, um, things will get better. It's just gonna happen because you're like manifesting that. You're not taking no for an answer. You're moving on. You're getting somebody that actually cares. You're getting somebody that's actually going to be taking this journey with you.
mhm,
One of my success stories is just a 20-year-old female coming into me with, of course, we diagnosed her with Ehlers-Danlos. I see a lot, as you can imagine, but She had Ehlers-Danlos syndrome. We diagnosed her with that. We opened her eyes to that genetic disorder. On top of that, we opened her eyes to the multiple nuances like POTS, like mast cell, like chronic fatigue and chronic pain. And we literally gave her our little roadmap, as we call it, and we gave her direction of care. And we then told her, listen, at this point, we can do nothing for you. You are going to be doing the thing for you now. You are the master of your own universe. You are the world's expert on yourself. You are going to dictate what you need to do next, right? We are just opening your eyes to this and telling you these are the people you should pick from, but go and see this person for this, your dizziness and your heart rate issues, your allergies and your IBS and your chronic pain and the twitching in your eye every night, things like that. So this 20 something year old female, you wouldn't think that she like, she just came in and she was so desperate and so much pain and she was in a brain fog. She couldn't think clearly. But once she got, that clarity of what's going on with her, it was like night and day. She said she was 90% improved
Amazing.
just speaking to us that day. And
Mm,
then the other 10%, she hit the ground running. She went to this doctor, that doctor, didn't take no for an answer, told them, listen, this is what's happening to me. This is my diagnosis. This is what needs to be tested. I need to look into this. Please help me. Please intervene. Let's see what we can do. I don't care what you have to do. I don't care, how many visits we need. Let's just do this thing. She came to me a year later. I was actually worried about her. I was saying to myself,
mm,
maybe she just fell off the face of the earth. Maybe she's just doing so poorly that she just gave up on medicine, on the medical field.
mm,
But she came back in a year, 110% better.
mm,
All she was filled with gratitude. That's it. And I was like, I can't believe my eyes. This is, yeah, it's amazing. you
mhm,
you fought for yourself. And I told her, this wasn't me, this is all you. I didn't do the work. I just told you, oh, this is what you have, get out of here, you know what I mean? But
mhm.
she did the work and she went through all these doctors and she got all this treatment, and maybe not treatment, maybe just lifestyle modifications. And she came back in a year, like her whole, like all these 2 decades of her life
Wow.
were just a figment of our imaginations. And now she started living at that 22 or 23 years old that she was at when she came back to see me. It was amazing. It's
That
one of the
is
things that stick out in
amazing.
my mind. Yeah.
And I love that you focus on empowering your patients, which is such a beautiful thing. I know we have lots of comments here just with people saying, I love him. Awesome. I
Appreciate
wish
you.
more doctors were like him. If someone does want to see you in particular or find a specialist like you, where can they get those resources and where can people connect with you further if they want to follow you along your journey as well?
So, the issue is that there's not many of us. I hate to be like a bearer of bad news, but
Yeah.
sometimes, as practitioners, we get a little overwhelmed, unfortunately, as we are all human. So sometimes we put a hold on, seeing new patients, and you'll see this often in the EDS world,
Mm,
especially, where sometimes I have to say, pause. We can't see any more patients because we can't be of service to you if we're burning out. You see what I mean?
mhm,
So I want to be as functional as possible to help direct your care. So as far as I'm concerned, I have actually put that pause down,
mm,
unfortunately. But there are, the limitation to at least the EDS world. And again, there's so many amazing practitioners out there that are not rheumatologists like me that have an affinity towards EDS. There's so many out there, allied health professionals that can spend time, that have the room in their schedules to see more and more people. For me, I have to treat lupus, I have to treat rheumatoid. There's
mm,
just no time, physical time in the day. And I would love to be there for everybody. Like something like this is what I can accept, like do, and I can do this day in and day out, so I can bring awareness. This is what I love to do. I'm even having a live talk in the Valley in June,
mm.
just to do just that, to be there for people where I can't be there in a clinic setting because you have 15 minutes with me. I think
Yeah.
that's ridiculous. But I have to work under insurance. I have to, make a living. So this is the problem with medicine. But what I can tell you is that when you go to the, let's say, the EDS Society page,
Mm,
you go to Dahlia, you go to James, and then they tell you we have people in our vicinity that work really well with us and are like-minded. It's about networking. It's about opening your eyes to that field of medicine that is outside the box thinkers. You don't always have to go to conventional doctors for your answers. So start thinking outside the box. And guess what? There are people that are more affordable than others. Not everybody's going to ask you for $5,000 out of your pocket for no
yeah.
reason. So
Mhm.
there are people out there. You just got to, like I said, you got to do a little bit of the work to kind of look into those people and find those people in your vicinity.
Mhm.
But there are concierge docs all over the place for EDS and dysautonomia. There are people that accept virtual appointments. There are people that are always open to you and will spend the time, like an hour of two in the consultation and the follow up. There are people out there, but as easy as to say, oh, go to this website, kind of difficult. But I could always share with you, Dahlia, like a lot of the resources that we have, at least apps, podcasts, websites, social media handles that people can follow. And I can share
Mhm.
that with you, and then you can kind of share that to whoever's asking. That
Love
would be
it.
something, a starting point.
Yes, absolutely. We'll get a blog up on our website. We'll link some of those resources in the comments as
Perfect.
well. And I think more and more people just need to be listening to their bodies, be willing to seek out people who can help them with that care and just receive that much needed respite that they've been looking for. But I so appreciate you taking this time. Like you said, you are just here to serve others. I appreciate you taking your personal time out to have this chat with us. And we just so look forward to continuing to learn from you and share your resources with our community because there are so many that benefit from them. So thank you for what you do. Thank you for making this time today and for helping people heal with each meal and feel with each meal, just like we are trying to. So we so appreciate if somebody wants to connect with you on social media, where can they follow you and your work?
I'll give you all that information
Perfect.
afterwards.
All
All right.
right. I'll link it in the
Yeah.
comments. Well, thank you so
Perfect.
much. It was so nice having this chat. I look forward to staying connected and to
Yeah.
all of those in our Good Gut gang. We hope that this has been really meaningful for you, really helpful, and that you continue to just seek to heal with each meal. So have a great day, everyone. We'll talk soon.
Thank you. Thank you so much. It was
Thanks.
an honor and a blessing. Appreciate you
Mm.
guys.